Alright guys, the primary focus of this screencast is to look in depth into the topic of movement analysis. This is a pretty important topic as it features quite heavily, usually as the first question in a lot of the AS papers, where you are given a sporting movement or sporting action and you're required to analyze them kind of in the format below that I've shown here and here, where you're given a table, and depending on what they've given you, the information they've given you, you must know the joint type, the type of movement that's being shown in the picture at a particular joint, the agonist, which we'll go into a little bit in terms of what the agonist actually is again, and you must also give the antagonist. And sometimes they do ask the type of muscle fiber that's recruited during the exercise, which we'll give an example for as well. But the main focus of this is to basically practice a lot of different questions, and hopefully you'll feel much more prepared when going into your paper this year to tackle a question like this. Unfortunately, there is no secret or easy way to learn this stuff. It just requires you to sit down and go through all the joints and muscles repeatedly until you know them. But hopefully I'll be able to help you here with just going through what joints you need to know, the types of synovial joints that they are, and all of the movements that can occur at each of the joints. And unfortunately, you need to know every single one of these because you cannot predict what movement they'll ask. So you need to go in with an understanding of all of the joints, all of the types of joints, what type of synovial joint they are, and also all of the movements and muscles that cause those movements. Okay, so the first joint that we're going to look at is the wrist joint, and this is a condyloid joint. Now remember, and I've said this in previous lessons, that anytime they ask for a type of joint, you automatically assume it's a synovial joint that they're talking about. So the joint, you'll never write synovial joint, as they will not accept that. It's always the type of synovial joint that they're looking for. So the wrist is a condyloid joint, and the two movements that can occur at the wrist that you need to know are flexion and extension. Very often they might ask a question about the wrist, maybe in something like a basketball shot or a netball shot, something like that. And the two muscles that are involved in these movements, quite easy to remember. For wrist flexion, it's the wrist flexors, and for extension, it's the wrist extensors. So two muscles that are quite easy to learn that you need to know if they do ask a question where the focus joint is the wrist. The second joint you need to know is the radio-ulnar joint, and this is a pivot joint, and the two movements that can occur at the radio-ulnar joint are unique to this joint, and they're pronation and supination. Now hopefully from this diagram here you can see what pronation is and supination is. Pronation is essentially where your hand, your palm of your hand is facing the ground, and that'll be pronation, moving into that direction. And supination is essentially the opposite, where you rotate your radio-ulnar joint round so that your palm faces towards the roof or towards the sky. That'll be supination. And two muscles that are involved in these movements, for pronation it's the pronator teres, and for supination it's the muscle known as the supinator. In terms of what questions or what movements they might ask, it's difficult to tell as they haven't asked a lot with the radio-ulnar joint, but they might ask something that involves tennis, or maybe catching a ball if they have to supinate their hand to catch a ball, maybe in baseball, something like that. But it is quite hard to predict, but just in case they do ask something, you need to make sure you can distinguish between pronation and supination and understand what muscles are involved. The next joint of interest, and one which is more commonly asked in the paper, is the elbow joint, and you should remember even from GCSE and throughout our lessons that the elbow is a hinge joint. That's the type of synovial joint that it is, and only two movements can occur at the elbow, and that's flexion, shown here in the diagram, and extension. The muscle that is responsible for causing elbow flexion is the biceps brachii here, and the muscle that is responsible for causing extension of the elbow is the triceps brachii. Now remember, it's important that you remember the brachy part at the end, as that they will not accept biceps or triceps alone. It's more of a GCSE answer, so you must get into the habit of saying biceps brachy and triceps brachy. One of the hardest joints to learn is the shoulder joint, and this is because there's so many movements that take place within this joint, and there are a variety of different muscles that you must know. And because the shoulder is involved in a lot of sporting actions, it is a very common joint that they may ask as well, and it can be applied to a number of different sporting movements. So you do have to sit down and go through each of these individually. I'll give an example on the side here of the different types of movements that may occur in a sporting situation at the shoulder. Firstly, the shoulder is a ball and socket joint, just like the hip, which is also a ball and socket joint, where the end of the humerus, which is the long bone, attaches into a cavity, which essentially is a ball and socket. So that's the type of synovial joint that it is. The first movement that we're going to look at is flexion, and this is caused by the anterior deltoid. They have shown before in previous mark schemes that they'll just accept deltoid, but if you want to be quite specific, the correct head of the deltoid, which causes flexion of the shoulder, is the anterior deltoid. The example I've provided on the right hand side is just a dumbbell raise, where the shoulder is raised above the head, or the arms raised above the head, and that is shoulder flexion. So anytime the shoulder or the arm is raised above the head, as shown in the diagram, that is shoulder flexion, which is caused by the anterior deltoid. The second movement at the shoulder that we're looking at is shoulder abduction, and you should remember from the definitions of the movements, abduction is the movement of a limb away from the midline of the body. So as you can see from this diagram example, the person is doing a deltoid raise, which is clearly showing shoulder abduction, as the middle deltoid is the muscle which is allowing the arms to be raised to the side away from the midline of the body, which is shoulder abduction. The third movement we're looking at is shoulder extension, and this is shown in the diagram provided, and this movement is caused by the posterior head of the deltoid, where the arms are basically brought back in a backwards direction, which causes shoulder extension. And you might see this at the start of maybe some throwing events, like a pitcher or something like that, where they have to bring their arms back, or it might be as part of a warm-up or shoulder mobilization exercise where they need to extend the shoulder backwards. The muscle responsible for shoulder adduction is known as the latissimus dorsi, or sometimes referred to as the lats, but obviously in an exam condition you would write the full name, which is the latissimus dorsi. And adduction is the movement of a limb, in this case the arm at the shoulder, towards the midline of the body. You're adding to the body, and this is caused by the latissimus dorsi. And a common movement that they might ask for this is, for abduction and adduction, is maybe the phases of a star jump, where in the outward phase of a star jump, where the shoulders and arms are going outwards, that's abduction caused by the middle deltoid, and then bringing the arms back into the body, or the hips, would be caused by the latissimus dorsi here, in this case the shoulder. Horizontal flexion and horizontal extension are two movements that you need to be aware of in the shoulder, and as you can see from the picture, horizontal flexion is where the arm is brought horizontally across the body, and that might be shown, or it might be quite easy to visualize in a pec deck weight machine, where you have to horizontally flex your shoulder, which is caused by, and as the name suggests, the pec deck, and this muscle is caused by the pectoralis major. Horizontal extension is the opposite movement, where the arm is brought horizontally across the body again, in an outwards direction away from the body, and this is caused by the trapezius. And finally, the last two movements at the shoulder that you have to know are lateral rotation and medial rotation, shown here. This is lateral rotation and medial rotation on the right hand side. The muscles that are responsible for causing lateral rotation are the teres minor and infraspinatus, and the muscles involved for medial rotation, which is the opposite movement shown here, are the teres major and the subscapularis. They are less frequently asked movements. However, if they do give a table where they've given the movement as lateral rotation or medial rotation and you have to name the muscles, be aware of the 4 muscles involved in both of these movements. The spine joint is a gliding joint, or it can be considered a pivot joint at the atlas and axes at the top of the spine, which cause the head to be able to move or pivot round and look in different directions. But very often in the 2014 paper they asked a question about a gymnast doing a bridge. For most sporting movements they will be asking about the other areas of the spine, which will therefore make it a gliding joint, but the joint at the top is the pivot. The joints that are the movements that you do need to be aware of for the spine are flexion, extension, and lateral flexion or rotation. For flexion, the muscle responsible for spine flexion is the rectus abdominis, sometimes commonly referred to as the abs. So spine flexion will be caused by the rectus abdominis. Spine extension is caused by the erector spinae group, which are the muscles that line the back, which line your back, and allow spine extension to take place in movements such as the bridge was a good example, or a back extension exercise which can be carried out in the gym. And finally, lateral flexion or rotation is caused by the obliques, the external and internal obliques. So those are the not too difficult, but those 3 movements you do need to know in preparation for your exam. Okay, so that leads us on to the hip joint, which just like the shoulder is a ball and socket joint, and the 4 movements that can occur at the hip are flexion, extension, abduction, and adduction. Okay, so on the right hand side we have 2 pictures that show hip flexion and hip extension. The top picture shows this person in a neutral position, just lying down, and he raises his left knee towards his chest. At the hip, this is actually hip flexion, and this will be caused by a muscle known as the iliopsoas. Below that, the picture of this girl who is moving her hip in a backwards direction is displaying hip extension, and this will be caused by the gluteus maximus. Hip abduction and adduction is shown in the diagram below, and just like the example I used with the shoulder, hip abduction would take place maybe in the outward phase of the star jump, and hip adduction would occur when you're bringing your leg back into the midline of your body or adding it to your body. The muscle responsible for hip abduction are the gluteus medius and the gluteus minimus, and the muscles responsible for hip adduction are the adductor grip, which is the adductor longus, the adductor brevis, and the adductor magnus. That leads us on to the second last joint that we're going to look at, and this is the knee joint. The knee is a hinge joint, just like the elbow, and it only allows 2 movements, which are flexion and extension. If we look at the top picture of David Beckham taking a free kick, his right leg is clearly in a flexed position. The muscles that allow this knee joint to flex in this movement before he executes the free kick or in the preparation phase is the hamstring grip. Now, just like I've said in the lesson, you cannot say hamstrings or hamstring grip because you will not gain any credit for that answer. You must learn the 3 muscles that make up the hamstring grip, and that's the biceps femoris, the semitendinosus, and the semimembranosus. So make sure that you know those 3 muscles. If you can name one of them, it seems that in previous mark schemes they've given you credit for that, but never write hamstring grip. And it's the same as the quadricep grip, which will allow knee extension. So the first picture here, his knee will be in a flexed position caused by biceps femoris, semitendinosus, and semimembranosus. Below the picture of Lionel Messi and his left knee, he's extended his leg through the ball to kick or execute the free kick, and this is caused by the quadriceps group. Again, you need to know the muscles involved, which are the rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedius. The final joint that you need to know is the ankle joint, and this is a hinge joint, just like the knee and elbow. There's only two movements that are unique to the ankle joint that occur, and this is dorsiflexion and plantar flexion. Dorsiflexion is quite well conveyed in this picture of a Gaelic player taking a solo, where he's having to point his toe towards the sky in order to get the ball to come back into him, and the muscle that pulls this toe towards his shin and therefore dorsiflexes the ankle is known as the tibialis anterior, which is the muscle that lines his tibia, hence the name of the muscle itself. The other movement that occurs at the ankle is known as plantar flexion, and this is caused by the gastrocnemius, or the calf muscle for layman's terms, and the soleus. Okay, a good example of this is shown in the sprinter coming off the blocks. We look at his left ankle here. He's planting his foot or pushing his foot against the blocks in order to gain an explosive start. And this is a good example of plantar flexion, where he's having to point his toes towards the ground. And this is caused by the muscles that I previously mentioned, of the gastrocnemius and the soleus. So these are just the two muscles that two movements and the muscles that you need to be aware of if the question in the paper is related to the ankle joint. Okay guys, I'm not going to extend the screencast any longer. My intention wasn't to talk that long about the muscles and the movements. However, it just shows you that there's quite a lot involved. I'm going to make a separate screencast that will just solely focus on exam practice and question practice on movement analysis. So if you do have a good grasp of the knowledge that we've covered in this screencast, you can just skip this and go straight to the exam technique or exam practice screencast. But hopefully this has helped you a little bit, and hopefully you do have a better understanding of it. Again, if there's any issues, just come and see me. But a lot of this is in your book and has been demonstrated throughout the screencast, so hopefully this will help you in your preparation for the exam.